Sorry, teka. Kaya ko na to. Kembot na to. Ba't ako ng energetic na to?
Hi everyone! Dr. Kaycee here, the founding dermatologist of Luminisce. When the pandemic started, I got so many concerns from patients about acne. Even those who never had trouble with pimples before were suddenly breaking out. We all know that excess oil and sebum can cause acne, but not all of us are aware that stress and hormonal imbalance can also be a quiet trigger. I invited a friend of mine who has been dealing with hormonal acne for many years. The secret to her finally overcoming it was very simple but super effective. Let's hear the story of our skin investor for this episode, Jen.
Hi, I'm Jen, and I'm a mom. I'm a business development in the logistics industry. I've known Kaycee for 8 years already. The first time I met Doc Kaycee, it wasn't through Luminisce. We met in a business event and I remember we hit it off agad. Mabilis ko siya nakilala and pretty soon, my daughter and I started going to her clinic. Kaya lang, my work can be so time-consuming and since we live in the South, it wasn't as easy for me to make it to appointments in Luminisce, BGC, or Podium. For a bit, medyo nahinto yung pagpunta namin. We tried going to other skincare centers, pero iba talaga yung luminous touch and yung holistic approach ni Doc Kaycee. So yung exciting part, when Luminisce finally opened in Alabang, feeling ko, Doc Kaycee really did that for me. O diba? Ang feeling ko doon. But me and my daughter were so thankful Luminisce is closer to us because it makes it even easier now to take care of our skin. Sa totoo lang, women in my industry, in logistics and supply chain, are rare. It's still very much dominated by men. So sometimes feeling ko, nagiging brusko ako, yung masculine energy ko parang nandyan. And then, I tend to forget to take care of myself and I end up deprioritizing my skin and its needs. That's why I really love Luminisce. They just don't understand my struggles with my skin, but they also know their patient's personality and lifestyle, and they adjust. Sila yung nagre-remind sa akin about my appointments. Especially if I haven't gone to the clinic in a while. Talagang feeling ko namimiss nila ako. When I go for a facial or another service, they really make sure there's very little waiting time, which is so important for me because of my schedule. Another thing I appreciate with Doc Kaycee is she never makes you feel like you're not beautiful. Yung parang, alam mo yun, yung bebentahan ka lang. Never. Never ko na-experience yun. Actually, what she does is she makes you feel really good about yourself. So you feel so inspired to take care of yourself holistically. Amazingly, it's not just her in the clinic. Buong entire team of nurses, estheticians, and front desk staff, parang pareho yung energy, pareho yung commitment. I just really admire the leadership of Doc Kaycee because she's able to impart excellence to her entire team. Kaya, talagang bumabalik-balik ako sa Luminisce. Medyo on and off yung acne ko. But now, it's really much better. Pero hindi maiiwasan yung feeling na at my age, sana, no, dapat hindi na ako pinipimple. Actually, dealing with recurring acne is what made me realize na important talaga to skin vest. But like I said, my acne now is so much better than before. And I really thank Doc Kaycee for that. She really took the time to know more about my lifestyle and what I was open to and not open to in terms of treatments. Her approach is holistic talaga. Meaning, she encouraged me to maintain healthy habits. She really helped correct my lifestyle. I remember I strictly followed her advice to avoid dairy and to drink a lot of water. And dun pa lang, I already saw na nag-improve yung acne ko. Then, she also asked me to maintain a skincare routine. So, syempre, obedient ako. I always make sure that I use my cleanser, my toner, vitamin C serum, and spot-correcting cream. Then, the usual treatments I have in the clinic are the luxury facial, favorite ko yun, and the co-kill peel. These are some of the most popular Luminisce services because they really, really work. Anyone who has hormonal acne will know that it can be very frustrating to deal with. Walang one-size-fits-all treatment. So it's important that you have a dermatologist whom you can really trust and who sees the bigger picture because there will be a lot of lifestyle factors involved. I'm so happy I have that with Doc Kaycee and Luminisce.
Hormonal acne is a top concern I hear from my adult female patients. That is why we also call it adult acne, and it's usually hormonally related. Normal acne is acne or pimple usually seen in the T-zone like forehead, nose, and chin, while hormonal acne is more commonly seen in the jawline and cheeks. And it's more resistant to treatment. And it's also interesting to note that 25% of adult women suffer from hormonal acne. Also, hormonally related acne means acne worsen before menstruation, persistent of acne despite conventional therapy, and sudden onset of acne. Hormonal acne is caused by fluctuation in hormones that usually happen during menstruation cycles, pregnancy, and menopause. This increases the amount of oil produced in the oil glands, which clog pores and interact with the bacteria of skin, resulting in acne or pimples. Causes of hormonal acne. One of the main causes is stress and lack of sleep. Secondly, it's comedogenic products like hair and skincare. Changing hormone levels in women during menses, irregular periods, pregnancy, and after discontinuation of birth control pills. Family history of acne, which has genetic predisposition, and side effect of medication such as steroids and testosterone, pre-existing medical conditions such as polycystic ovarian syndrome and other metabolic causes, and poor diet, specifically refined carbohydrates and sugars. So what are the indications to pursue an endocrine workup for acne? Number 1, acne of sudden onset, in particular, no prior history of acne. Also, acne with associated excess hair. Acne with associated irregular menstrual cycles, and acne with associated hyperandrogenism like increased libido, darkening of neck and armpits, deepened voice, insulin resistance, or patterned hair loss. So many of us deal with acne. But it's very interesting to note that even in adulthood, acne flare-up can still happen. So hormonal causes should always be considered. How do we treat hormonal acne? For inflammatory acne, we can use topical therapies such as Epiduo and Duoc, which is a combined retinoic acid and benzoyl peroxide and even antibiotic. This is a good complement for patients who have severe acne, and it will complement good oral medication and in clinic treatments. For moderate to severe acne, we often combine with oral antibiotics or oral isotretinoin. And for cystic acne, the best is to inject intralesional steroid injection. Hormonal therapy might be advised by your dermatologist, such as oral contraceptive pills, spironolactone, and adrenal androgen blockers. But this should be discussed with your doctor since each of the said oral medicines have potential side effects. This tells us that there's a link to acne and hormones, which is why I advise Jen right away to consider some tests so we can prepare her for treatment that will give her optimum results. Jen preferred a topical intervention at first, but then since it's persistent, we combined oral medication for her hormonal control and added some diet changes. We also supported this with treatments in the clinic. One of those treatments is an original facial from Luminisce called the Luxury Facial. This facial is unique because it includes the process of sonophoresis, which uses ultrasound waves to deliver vitamins deep into the skin. Jen also regularly gets the Coquille Peel. It's her signature peel that uses natural alpha-hydroxy acid to exfoliate dead skin cells and to restore the skin moisture. Both the Luxury Facial and the Coquille Peel rebalance the skin and restore its natural barrier, which helps in the treatment of acne. We also use Heal Light, an LED light therapy which harnesses the healing power of light in precise wavelengths for a total skin rejuvenation solution. By sending soothing energy deep into the tissue, Heal Light works on a cellular level to combat active acne and reduce inflammation. Another thing that we're doing differently is we're letting Jen try lasers that can kill the bacteria that is causing the acne at the same time, and it can remove acne pigmentation and prevent acne scarring. For Jen, she has always liked Luminisce Acne Clear Laser because it's a completely non-invasive treatment that uses Spectra XT technology. What it does is normalize the blood vessels around the wounds caused by cystic acne. So not only does it significantly reduce inflammation and speed up the healing process, it also prevents future breakouts. Now, she's going to try Pico Plus laser that uses the most advanced technology of Pico. It will not only target the bacteria and inflammation, but it will also effectively remove red and dark pigmentation caused by acne. At the same time, can significantly reduce large pores and acne scarring. Take-home message: if response is poor, what do we do? First is check other possible causes like seborrhea or oiliness, stress and diet, Malassezia furfur, which is a fungal organism, gram-negative bacteria, skincare products, and endocrine profile of the patient. We also probe patient's adherence like application technique, missed doses, and tolerability.
Before, I used to visit the clinic twice a month to address all my acne concerns. Now, with Pico Laser, once a month, perfect na. I'm Jen Alcano and I'm a Luminisce skin investor.
Acne can take a toll on us physically, mentally, and emotionally. When my patients like Jen finally find freedom from acne, it also makes me so happy as their dermatologist. If you've been struggling with acne, let's talk about it. You can check out the description box below for Luminisce details. And if you enjoyed this episode, do like this video, subscribe to our channel, and hit the notification bell.